Well, good afternoon, everyone, and thank you for joining us for our weekly update. I want to once again thank our council, our city staff, and of course our residents and businesses for their support throughout this crisis. Earlier this week, Premier Ford announced updated modelling for Ontario that appears very promising. It shows that our efforts to contain the virus are working. And while we have likely reached the peak of community spread, now is not the time to take our foot off the gas. Cases and deaths continue to rise, especially in our long-term care homes. And while we've come a long way, our job is far from over. Now is not the time to relax or to bend the rules. We must remain vigilant, stay the course, stay strong, and continue to battle the virus as Team Mississauga. Today I am joined by Dr. Lawrence Lowe, our Medical Officer of Health at the Region of Peel, Tim Beckett, our Fire Chief and the Manager of our Emergency Operations Centre, Carolyn Riseborough, President and CEO of Trillium Health Partners, and Senator Victor O, who is also a Mississauga resident. I'd like to provide you with a brief update on what we've been up to, and then invite Dr. Lowe to brief us on Peel Public Health's efforts. We have seen an over 500% increase in cases here in Mississauga since the start of the month. We currently have just under 1,976 cases, which represent a 1% increase, or 16 cases over yesterday. Provincial testing scaled up significantly last week, and our stats are now truly reflective of the number of cases in our community. We know what we're up against, and we must continue to battle with all of our might. While unfortunate with the warmer weather, we will continue to see people violating park amenity closures and not keeping a safe distance or bending the rules when it comes to gatherings with family and friends. Last week, we had an unfortunate and inexcusable incident where one of our bylaw officers was punched in the face while approaching a group of 8 men gathered around a fire pit in the Malton Greenway. That individual was apprehended and charged with assault by Peel Police. He was also issued a ticket for violating the province's emergency orders. It's unfortunate and frankly disgusting that one of our officers was being subjected to physical abuse simply for doing their jobs in this time of crisis. To our bylaw and our security officers, I know it's not easy, and you are being asked to go above and above and beyond right now. Thank you for all that you do. Last weekend, our officers stopped and educated over 6,500 people and turned away 3,500 cars from entering our parks. We also issued 22 tickets. That's 14 more than the weekend before, for a total of 60 tickets that have been issued. Several of these tickets were related to discarding PPE, medical masks and latex glove on the grounds or in carts outside of grocery stores or on the road or in parks. I want to remind residents that this is littering, and it carries a fine of $365. It is also unsanitary. It is a public health risk and puts the health of our workers at risk at this time. So please, just don't do it. If you can't find a garbage bin, turn your gloves inside out and take them home with you. While for the most part we have great compliance, we also have to crack down on non-essential businesses that have been operating. We've had issued notices of contravention to some shops, including a boxing and taekwondo studio, a vape shop, balloon and party store, and even a religious organization. We also have been cracking down on reckless behavior in our parks, from jumping fences to playing soccer and tennis to joyriding through our parks at night. There are consequences for your actions. For those that think this is a bit harsh, know that the people we are ticketing are fully aware of the rules and are choosing to ignore them. We will continue to have boots on the ground to do our part to keep you safe. Mississauga continues to work through this pandemic, and our council meets each week virtually through WebEx. We just wrapped up a meeting a very short time ago. So today I have a few announcements for you. The first update is it's important and essential spring road maintenance work will continue. While we don't have as many people driving on our 5,600 kilometres of roads, we are committed to ensuring they remain the best in the GTA, even during these challenging times. We also continue to work to close lanes of traffic so that they can be used by pedestrians and cyclists instead. City crews are working to do priority work and repairs such as fixing potholes, fixing sidewalks, cleaning drains and catch basins. Parks and forestry staff continue to care for our parks and our natural areas, as well as responding to emergency requests. Our crews are focusing on major roads and industrial areas right now where we can ensure proper physical distancing from the public. Work on residential streets will only be done if there is a safety risk or in an emergency. So please, don't call 311 if there's a small pothole on your street. We are focused on high priority and essential work only right now. Secondly, we have installed webcams in Korea Park. This is very good news, so people can enjoy the beauty of our cherry blossom trees, but from afar. As you may remember, we announced a few weeks ago that we'd be closing the park during cherry blossom season. The park is so small and would be virtually impossible to prevent crowding and to ensure proper physical distancing. So thanks to technology, residents will still be able to enjoy them in all their glory, but from the comfort of your homes. We expect them to be in full bloom in the coming weeks, and our webcams will be live starting April 27th at mississauga.ca/cherry blossom webcam. Very exciting news. Third, we are launching an interactive GIS mapping dashboard that will act as a data hub for COVID-19 services and support in our community. This dashboard will map over 400 services, including mental health supports, food banks, senior services, homeless shelters, youth organizations, hospitals, healthcare clinics, and much, much more. It is so important that our residents who need support can easily find out what is available to them close to their homes. I encourage residents to visit this website, which will be hosted on our mississauga.ca/coronavirus website. Third, last but not least, I want to address Mississauga's plans for recovery. The case projections from the province earlier this week are promising. They show that if we stay the course and maintain current actions, we will get through this sooner rather than later, sooner than we had originally thought, and with fewer cases. But we can't stop now. Let's do the right thing. Let's do it the first time, and let's do it just once. But as we look to the future, we must start looking at reopening our city and what that will look like, and how we recover from this crisis. To that end, Mississauga has convened an internal working group of senior staff across the corporation to begin planning with what the new normal will look like. We have not yet had a firm timeline for reopening. No one has that timeline yet. But it is important that when we do, that we're ready. There will be multiple stages to the recovery. It seems certain that no one will return to business as usual on day one. Physical distancing, increased hygiene and sanitation will remain part of our daily lives indefinitely. And that will impact how we're running facilities like our recreation centres and our libraries, how we deliver services like road and park maintenance, and when our office staff who are working from home can start coming back into City Hall to work. We have followed the guidance of public health experts to date, and we will continue to take our lead from them. Our priority will continue to be the health and safety of our staff and our customers. I'm also working with our Economic Development Office to learn more about the impacts of each of the sectors in our city to better understand their needs as we work towards recovery. We're also listening to the faith groups, social service organizations, the resident associations, all of whom we've been consulting with, and all of whom will be part of our plans moving forward. I'll have more to say on this in the weeks to come, but I think it's important to let residents know that we're looking to the future and how to reopen our city and recover from this crisis. And we're going to do that in a measured way. We're going to do it slowly and effectively. Brighter days are ahead. We just need to be patient and stay the course for now. I want to thank Mayor John Tory of Toronto for organizing a call on Monday with all our fellow GTHA mayors and the regional chairs to discuss a coordinated and a collective response to reopening and the recovery. As an economic engine in Canada, it is critical that we act together and that we have partners in the federal and the provincial governments to assist us when we restart our cities and our local economies after this crisis. I want to now invite Fire Chief Tim Beckett, who is also responsible for leading Mississauga's emergency operation, and provide us with an update on their efforts. Chief Tim Beckett.
Well, thank you, Madam Mayor, and good afternoon. The City of Mississauga activated the Emergency Operations Centre on March the 11th, and we've had eyes on this pandemic for the last 43 days. I've had the privilege to work with many dedicated individuals that are working 7 days a week on the city's response to the COVID-19 pandemic. We continue to ensure that we have essential services in place to meet the critical needs of this community. We are working closely in conjunction with Peel Emergency Operations Centre and the Peel Public Health Unit. We have put on enforcement teams in place to deal with those that wish to ignore provincial orders. We have focuses on educating and mostly making sure that people are cooperating with these provincial orders. However, as Mayor Crombie indicated earlier, we are still seeing a high number of people that are driving to parks and being turned away. We understand that people want to get out and want to exercise or get some fresh air. But we ask that you do this in the area you live. Please do not be driving to the parks. Our current activities right now include the assembling of a team to examine and develop various recovery scenarios. In working with public health and various other levels of government, we, like others, are awaiting guidelines on timing and the processes that we will need to see put in place. As these become more clear, we will be in a better position to communicate our plan further to the public. As the fire chief, with everybody spending more time at home, I want to remind everybody to remain vigilant around fire safety. Fire does not pause for this pandemic, and we need to ensure that your homes are fire safe. Do not leave cooking unattended. Ensure that candles are used safely, and discard any smoking materials safely. I want to remind everybody during this time, please remain safe in all aspects of life. Thank you.
Thank you, Chief. And now I'd like to turn it over to our Chief Medical Officer of Health, Dr. Lawrence Lowe, to provide us with a brief update on the Peel Region's response to the virus, and I hope that you can particularly address the situation in our seniors and our long-term care homes. Dr. Lowe?
Thank you, Madam Mayor. Thank you, Chief. Good afternoon, everyone. It's an opportunity. Thank you for the opportunity to present an update on Peel Public Health's response to the COVID-19 pandemic. As of this morning at 10 o'clock, we have 1,820 confirmed cases of COVID-19 in the region of Peel. 976 of those are residents of Mississauga. We have a breakdown by age group of 571 in residents of the region over the age of 65, 899 of residents of the region aged 35 to 64, 322 in residents of the region aged 18 to 34, and 28 in residents aged less than 18 years of age. In addition to the case numbers, we are also seeing passings in the region of Peel with 58 deaths due to COVID-19 complications. 42 of those were residents of Mississauga, and in the breakdown across the region, 53 deaths have occurred to people aged over 65, 5 in individuals aged 35 to 64, and 21 of deaths overall have occurred in long-term care settings. We are also seeing increasing hospitalizations and ICU admissions in our healthcare settings, and at present we have 15 long-term care homes across the region of Peel in outbreak, 3 retirement homes in outbreak, and have dispatched nearly over 2,000 testing swabs over the past few days to assist with a broader testing strategy in those settings. So certainly in reviewing the numbers, I imagine the next question on your mind is, what do they all mean? To our perspective, there are encouraging and hopeful signs of a turn in the region of Peel, but, and this is a very important but, we are still very much deep in the woods. There are two pictures that are emerging. There is certainly an improving community picture, which speaks to the importance to keep up our physical distancing measures and the steps that we have taken to slow community spread. However, we have a picture in healthcare settings, in long-term care settings, and congregate settings throughout the region and in Mississauga that draw us to immediate action. What it also means is that this is far from over. For those who have lost loved ones, we know that it adds grief to a very difficult time already. For those who are on the front lines as our first responders, our healthcare workers, the essential service providers, and those that are working in long-term care and congregate settings, we know that it adds continued uncertainty. Know that we at Peel Public Health stand behind you all in these difficult times and continue to support all your efforts. We also know that the changes in case count may mean more questions for those who have doubted what we have recommended or how we have recommended it, and certainly may also raise questions for those who choose to disregard our advice. I want to be clear that Peel Public Health will always continue to provide you with the best guidance of what we know and why we are doing it. It is hard to remember that 6 months ago, we didn't necessarily know what COVID-19 was. And while we were prepared, we are still constantly learning lessons as the pandemic evolves in our community. But for now, I want to draw your attention on the immediate need and review and reinforce what we know, why we're telling you to do it, and why it's important to work with us. So, at this critical juncture, I will remind that COVID-19 is a brand new disease. Anyone can get it. No one is immune. There is no cure, and there is no vaccine. And while most cases are mild, severe outcomes can occur to anyone, but especially amongst those over the age of 70 and those with medical conditions. And that is why we have recommended and put in place measures to encourage physical distancing. And this speaks to the advice that we have repeated throughout the past few weeks. If you are sick or returning to Canada from outside the Peel community, outside of Mississauga, please self-isolate. That means in your home for 14 days. If you are well, stay home as much as you can, emerging only for essential reasons, groceries, prescription, visiting the doctor, or exercise on your own, with a pet, or with a household partner. If your business has been asked to close, we ask you to respect that. And if you are an essential business, please ensure that you are maintaining physical distancing on your premises and, to the extent possible, moving to reduce interactions, such as moving to curbside pickup or delivery. We also know that all countries and jurisdictions will need to pass through the pandemic phases of containment, mitigation, and recovery. Of course, recalling the tragic losses that have happened in our community, our country and our provincial data shows that there are glimmers of hope that we are turning for the better. However, we have to remember that our picture in Peel and in the Greater Toronto Area is vastly different from the rest of Ontario. I encourage you again to not look solely at the cases which are slowing and which is positive, but also look at where cases are now starting to come up. As has been described and as the Mayor alluded to, we are very concerned and currently working full force in our long-term care and congregate settings. Peel Public Health continues to identify and isolate cases, aggressively conduct contact tracing, provide credible information and guidance on protocols, and work with our healthcare system partners and hospital partners to implement enhanced infection prevention and control measures and support personal protective equipment and staffing needs in long-term care homes and senior settings in our region. So that is what we know, and that is what I need to reinforce today. And finally, in sharing what we don't know, the one thing that we are all hopeful is that this will eventually reach a plateau. And in the short term, we're hopeful that this case count will start to stabilize. But the question of the true length of how long this is going to go is one that no one actually has an answer for. And to paraphrase my daughter's favorite Disney movie, no one knows how far it'll actually go. That is why it is important for us to focus on the immediate and now and the steps that we can take to bring this under control in our community. I want to say that what we are doing is working, but we must continue. Cases are slowing, but our healthcare picture and our congregate care picture is starting to take flight. We are far from out of the woods, and we must double down in the here and now to know that a better day will arrive. My thanks to all of you for doing your part. I'll pass it back to Madam Mayor.
I want to just take a moment to thank the incredible frontline healthcare workers. Whether you're a doctor, a nurse, a PSW, or a paramedic, you are the face of bravery and courage, and this fight would not be possible without you. You put in long shifts, you sacrifice time away from your families, all to keep us safe. And for that, we can never repay you. What we can do, and what we are doing, is working to rally the community to help raise funds to ensure that you have what you need to be safe on the job. I personally have donated to Trillium Health Partners and encourage you, if you have the means, to do so yourself. Our hospitals need us now more than ever before. Trillium Health Partners has done an outstanding job managing the demand on their 3 hospitals. They continue to ensure that we have the capacity, the staffing, the supplies that are needed to ensure that residents continue to receive the highest quality possible health care. They have launched a PPE drive to raise funds and donations for face shields, masks, and gloves for the frontline healthcare workers. Our nurses and doctors continue to have what they need thanks to the incredible generosity of residents and local businesses. We have seen companies like MHI Canada Aerospace, Shop 3D, and Baylis Medical retooling or adding PPE or ventilator production to their manufacturing lines, and this is pretty incredible. I could go on and on, but I'd like to invite Carolyn Riseborough, who has been leading the charge at Trillium Health Partners Foundation, to provide us with a quick update on their efforts. Caroline?
It's an honor to be here on behalf of Trillium Health Partners Foundation, and let me just start off by acknowledging the leadership of Mayor Bonnie Crombie in keeping all of our residents safe here in Mississauga and for her leadership during these trying times. As mentioned, the hospital at Trillium Health Partners is doing a remarkable job, as well as all of our frontline healthcare workers. And they are working incredibly long hours and going through a very stressful time right now. So we want to just acknowledge them. But what's been incredibly encouraging is that the community has responded to our needs with an outpouring of donations, from PPE to financial support on all levels. To date, we've raised an incredible $1.8 million from residents in Mississauga and the surrounding area. So on behalf of all of us at Trillium Health Partners, a big thank you. We've also had over 200 unique donations of in-kind support, everything from life-saving personal protective equipment to donations of food and meals and other needs to help our healthcare workers. This has equated to more than 340,000 individual items, so thank you again to our community. We've also seen an outpouring of support for our frontline healthcare workers and their other physical needs. We've had everything from coffee to meals, from breakfast, lunch, and dinner provided by our community, with more scheduled, so thank you again. Also, our community has posted 450 messages of support to our frontline staff to encourage them along. And I encourage more of our residents here in Mississauga to continue to do the same, and they can do so by visiting our website at trilliumgiving.ca. We've also had community groups step up and set up personal fundraising pages through Trillium Health Partners Foundation, including our very own Mayor Crombie. So thank you for that. And then a special thank you to all Mississauga businesses and organizations and individuals who have been supporting Trillium Health Partners Foundation during this time. We could not do this without you. But it's clear this is going to be much more of a marathon than a sprint, so we just want to continue to encourage those who are able to donate at this time to consider donating, whether it's donations of in-kind or PPE, and obviously financial donations as well. So please do visit trilliumgiving.ca. A big thank you as I wrap up to Mayor Crombie for her leadership, and thank you to all of our Mississauga residents who have truly shown their support for our hospital. On that note, it is my pleasure now to introduce Senator O, one of our incredible volunteers who has stepped up to help the hospital. Senator O has both organized donations of PPE as well as financial donations to Trillium Health Partners. So it's my pleasure to welcome Senator O.
Good afternoon. Thank you, Mayor Crombie and Caroline. It is my pleasure here to join you for this important conference. Today, I sincerely hope that all of you are well, keeping well, and during this challenging time. I would like to take a minute to recognize this is a volunteer week for everybody who come out to help or one way or another, and of course also during this time our frontline workers are so important. They are here to take care of the sick. And I would like to say all community during this time has come out to help one way or another on PPE and cash donation. And I would like to say the Chinese community in their effort to support our frontline workers. Through their general donation, they were able to donate PPE for our local hospital, including gowns, masks, and gloves. I would also like to acknowledge Canada, Toronto, Fuqing, and the Mississauga Chinese Business Association for their generosity to this cause. Tomorrow, there will be another lot of PPE arriving at the Trillium Hospital, including all kinds of PPE and 15,000 more masks arriving for the frontline workers. I wish you all good health during this difficult time. Please continue to follow the public health guidance to stay home, stay distant, wash your hands, wear a mask if necessary. We are all affected by this situation. During this time, we must all come together to help to fight against COVID-19 and do our best to support those who have felt by this impact. Thank you again, and stay safe and stay healthy. Thank you.
Thank you to Caroline, and especially to Senator Victor O for your tremendous display of generosity. We thank you. I also want to take a moment and thank hometown basketball champ RJ Barrett for generously donating $100,000 to the Mississauga Food Bank this week. What an incredible donation, and it will provide 200,000 meals for families across our city who are struggling right now. RJ, thank you very much. As we approach the start of Ramadan tomorrow night, I'd like to say Ramadan Mubarak to our city's Muslim community. I know that many of you will want to gather at mosques and in homes with extended family and friends. Please don't. I ask that you continue to practice the pillars of Ramadan, charity and sacrifice, but by staying at home. Many mosques across the city will be offering services online throughout the month, including experiencing the joys of sharing iftar dinner with family and friends from the comfort of your own home. You can do so, but do it virtually. Thank you. I wish you strength and focus as you begin the month of fasting, and ask that you continue to practice zakat by thinking of ways that you can help neighbors and family and friends cope, whether it's by dropping off meals or groceries or simply calling in to check those who are isolated, especially our seniors. Please remember to call your parents or your grandparents. I want to thank the Muslim Council of Peel and mosques throughout the city for their leadership and support during this challenging time, including generously donating to our food banks and, of course, our hospital. I know that we're all eager to get life back to normal. Your efforts are paying off, but the job is just not done yet. We've come a long way in the past few weeks, but we need to continue to buckle down and stay the course if we're going to stop the spread of the virus and to prevent a resurgence, a second wave. For those of you who have been listening, thank you. We continue to take a Team Mississauga approach to fighting the virus. And finally, I'd just like to say that we have lowered the flags in sympathy and in solidarity with Portapique, Nova Scotia. What a horrific tragedy. My heart and prayers go out to the families of the victims, especially the family of Constable Heidi Stevenson. And now we're ready to take questions from the media. Thank you.
Mayor Crombie, your first question comes from Steve Cornwell from the Mississauga News. Steve?
Welcome, Steve.
Please go ahead.
Thanks, Nicole. Good afternoon, Mayor Crombie.
Welcome, Steve.
Just a question first about kind of this recovery piece that was discussed today. There's been kind of comprehensive aid packages for various sectors announced by the federal and provincial government to date. Does it concern you at all that the other levels of government haven't really announced any help for municipalities to date?
Well, certainly it is a concern for me because you know as well as I do that municipalities don't have any ability to run a deficit, and many of us are facing very large deficits right across the country in the billions of dollars across the country. So we have been in discussion with the federal government, with our Deputy Prime Minister Chrystia Freeland, as the big city mayors meet each week virtually discuss this very item. So we're very hopeful that our message has resonated with them, and we're hoping for the same sort of assistance that they gave to businesses in form of business continuity funding. For us, it's operating revenue that we need very desperately. So we're hopeful that we'll hear something soon. We suggested to them that the gas tax was a great way to get money directly to cities and do it quickly. But I also know that they want to fuel the recovery, and there will be stimulus funding to kickstart our economies and help us with infrastructure and transit, etc. Thank you, Steve.
Just wanted a quick question for Dr. Lowe, too, if possible.
Certainly.
Hi, Steve.
Hi, Dr. Lowe. I understand from a report in the Toronto Star that Peel Health is now collecting COVID-19 data related to race. And just a question around, when is Peel starting to collect this race-related data? Why is the region doing this, and how will it collect this info?
So that's a very great question, Steve. As you know, reports around COVID-19 outbreaks in other jurisdictions have indicated that there has been significant impacts to specific communities based on certain indicators such as race and occupation. And so earlier this month, Peel Public Health began to initiate a systematic collection around that, at least as a pilot project, just to see what sort of patterns and trends we were examining. And we are going to continue that and evaluate it in the weeks to come.
Thanks, Steve. Mayor Crombie, your next question comes from Isaac Kellen from The Pointer. Isaac, please go ahead.
Hi, Mayor Crombie.
Hi, Isaac.
I want to follow up on the comment you made just now about stimulus funding, particularly for infrastructure, and ask if there have been any conversations between yourself and staff or staff and council regarding what projects might be at a stage in the city that you could put them up for stimulus funding as we head towards a recovery.
It's a very good question, Isaac, and certainly our council has that list. We have prioritized our infrastructure projects, but more importantly, I'd like the government to focus on the needs list, not on the wants list. We need operating revenue. We need to fund our day-to-day maintenance projects like our roads resurfacing, like the day-to-day projects to help get our rec centers, libraries, arenas back into operations. So that would be my priority, and I think the rest of the big city mayors and the small municipalities right across the country will need operating revenue.
Thank you. And to follow up on your mention as well of pedestrian and cycle space being expanded during COVID-19, it's something that's happened across the world. I was wondering how much space is going to be opened up in Mississauga and if any of it will become permanent after the crisis.
Certainly, as we've been giving some consideration to that, there is a list of streets that the commissioners have proposed, and they're working with each of the councillors that we can open those streets, close them off to traffic, and use them for pedestrian walkways and for cycling. So, you know, it's a great thought that we look to keeping some of them open permanently, but it's a discussion that our council has yet to have.
Mayor Crombie, your last question comes from Ashley Newport from Mississauga. Ashley, please go ahead.
Mayor Crombie.
Welcome.
So we know that already the city is going to be facing a significant financial shortfall, even, especially as physical distancing measures continue on over the coming weeks. I was wondering what impact, if any, this is going to have on some of the bigger city-led projects that have been announced over the past few months, such as the Central Library renovation and the Triple Meadows Community Center redevelopment.
So what we do know, Ashley, is that we're at about a $43 million deficit today, about $60 million by the end of June. And if this pandemic continues for 6 months, it'll be in the realm of $90 to $100 million. So, we're going to have to take a long and hard look at even our capital projects to see what could be delayed or deferred. We're going to have to take a really serious look at our budget process, because if we're $100 million in deficit, there won't be a lot of money for renovations and rebuilding. That said, I'm certain that the federal and the provincial governments will offer stimulus packages with respect to infrastructure and transit, and they know that's one of the best ways to kickstart our economies and get people back to work.
And then just as another quick follow-up question, because this is going to be such a huge financial challenge over the coming years, even with assistance from other levels of government, do you see yourself having to, raise property taxes more than you normally would, or raise fees more than you normally would to kind of help the city recover?
We've done a sort of an informal analysis, and it looks like there would be what would be needed would be a 17% increase in property taxes to make up the difference. So certainly that would not be an avenue that we would go down. There are lots of options, including delays and deferrals. In addition, the city is well run. We have healthy reserves, and we could look at reserve funding. We could delay things over a period of years, Ashley. But Mississauga, we're very fortunate that we do have healthy reserves and maybe in a better position than other municipalities. But this is an issue that every single small and large municipality, city will face right across the country, and we'll all have to come to terms with that. And so there will be a lot of discussions on how we move forward and whether we'll receive assistance from other levels of government, which I hope we do. And I certainly don't want to be in any position where they consider allowing us to run deficits. I'll say the municipalities, the cities are the only level of government that aren't permitted to run a deficit. And in fact, we've had the lion's share of the burden of the expenditures, because we, of course, are funding the essential workers in our cities: fire, paramedic, many of the healthcare workers, police, and our transit drivers, etc., who are taking our essential workers to work. And we are the only level of government to date that has been laying off people in Mississauga. We've laid off 2,000 part-time workers who are otherwise staffing all of our recreational and cultural and sports facilities. But I think,
Thank you, Ashley.
Yeah, I think that, I believe that the mayors right across the country, as well as the other levels of government, our partners of the federal and provincial governments, will come together and have these discussions on how we best move forward as a result of the pandemic and moving into the recovery.
Thank you, Ashley. Mayor Crombie, there are no further questions. This concludes today's press conference. On behalf of Mayor Crombie, I want to thank everyone for participating. Our media team will be sharing a link to the video of today's press conference shortly. Have a great day and stay well. Thank you.
Talk to you at 5.